Doctors throughout the world have long engaged in abusive acts of torture. Students, a vulnerable, needy, young population, have always been vulnerable to torture. Using finely practiced methods, medical educators, doctors, use psychological torture techniques to get information out of students. Let's tell them to study, but not give them any exam questions.
Here, running up here and here, we can see, perhaps to see it better here, along here.
Students are forced to become coffee addicts, up until 3 a.m. studying how the sartorius muscle originates from the anterior superior iliac spine. Coffee, a precious substance to said students, being banned by the administration. But doctors' real role in torture begins far from the NUIG campus. Well, maybe not that far away.
A new report by Physicians for Human Rights titled Doing Harm, Health Professionals' Central Role in the CIA Torture Program, finds that medical personnel played an integral role in monitoring, calibration, and design of the CIA's torture tactics.
The Department of Justice lawyers tried to argue that their program of enhanced interrogation technique was not torture. They were relying on medical professionals who were saying this is safe, it's legal, and it's effective.
Now to a new report that says medical professionals working under U.S. military orders have been complicit in the abuse of terrorism suspects.
So what exactly is torture? Well, according to the Oxford English Dictionary, it is the action or practice of inflicting severe pain on someone as a punishment or in order to force them to do or say something. The Hippocratic Oath was developed nearly 2,500 years ago, but one must ask if it is still relevant in this ever-changing modern world. While the broad principle of do no harm certainly still holds value, if this is true, how can doctors become complicit in torture and similar acts? Now for a bit of history. There is a long documented history of torture. As we can see from this graphic, from the 1930s and World War II, right up to recent times in Guantanamo Bay. So what exactly does doctor-directed torture look like?
5 detainees were subjected to so-called rectal rehydration, or feeding through the rectum with no medical necessity.
Yes, forced rectal rehydration, and the details of that in a footnote of this report are so graphic, not even Helen Mirren can make them sound appealing.
Majid Khan's lunch tray, consisting of hummus, pasta with sauce, nuts and raisins, was pureed and rectally infused.
According to Thomas Burke, a Harvard Medical School professor and emergency physician at Massachusetts General Hospital, no one in the United States is hydrating anybody through their rectum for all practical purposes. It's never used. Doctors use their knowledge of human anatomy to torture victims using techniques such as rectal feeding and waterboarding. Doctors can also indirectly participate in torture by giving medical advice, saying that patients are fit after flogging assessments, falsifying medical reports, by failing to report torture, and by devising techniques that allow torture without leaving evidence. Why do they do it? How can they go against the Hippocratic Oath, which they promise to uphold? There are many different factors which may lead a doctor to have a role in torture. We must first consider individual factors, such as career, economic, and ideological reasoning. Nextly, there is bureaucratic necessity. Some doctors work in a system in which their loyalty to their employer is assumed and expected, and they find it difficult to oppose this system. Some doctors may be pressurized and persuaded to participate in torture. Some organizations link torture with grandiose objectives such as national security and the justice in fighting the enemy. Doctors may also be offered rewards in return for their involvement. Some doctors may work in an environment where torture is just part of everyday life, such as the doctors in Nazi Germany. Some doctors lack awareness and education on medical ethics, and they believe that if they are not actively involved, but only passively involved in the torture, then they have not played a role in the torture at all. What would you do in their situation? You will have a role in torture as a doctor, a role in preventing it, and a role in treating victims of it, be it abroad or at home. With the rise in the number of asylum seekers and refugees seeking healthcare in Europe, this may become a far more common occurrence. Many of you will recognise this Red Cross. It stems from the Geneva Convention that took place following World War II. 4 treaties and 3 additional protocols were designed that establish the standards of international law for humanitarian treatment during conflict. The Declaration of Tokyo was agreed in 1975 by the World Medical Organization. It is a set of international guidelines for physicians concerning torture and other cruel, inhuman or degrading treatment or punishment in relation to detention and imprisonment. Unfortunately, these Allied agreements have been the target of war tactics and have forced some hospitals to take down the red flag in order to avoid being targeted. While the Irish Army recognises the Geneva Convention on Torture and all representing medical personnel follow it, treating victims any side of the war with the utmost duty of care. This is not the same for all armies, and this flag can be seen as a bombing target in some war tactics. So what can we do in our tiny little corner of the world to help victims of torture? Do you know?